guys, welcome back to my channel. If you're new here, my name is Penny. I'm a certified advanced esthetician in Portland, Oregon, and today we are going to talk about dermal rolling and microneedling. I did a video quite a while back and I've gotten so many questions on that video and so many of the same questions over and over that I thought I would make kind of a follow-up video and answer some of the most commonly asked questions about, especially about at-home needling. There's a lot of questions about that. I also needled myself 3 days ago and I've taken a progression series of photos. I took photos during and I took them after a few hours later. I took them the next day, day 3. I took them today before I put on makeup, and I will definitely be putting those throughout this video so that you can kind of see the progression of microneedling. I did microneedle with a 0.5 millimeter pen and I did not go any deeper than that on my whole face. So just know that I was going for collagen induction and you will see how deep I get with a 0.5, how effective it is, and the progression of my healing process. I think that'll be helpful for some of you to kind of know what to expect. Let's get started. The first question is, can you microneedle every day? And the answer to that is yes, as long as you're using the right length needle. Now, if you're using a 0.2 or a 0.3 millimeter, that's a really, really short little needle on a derma roller, for example, or you're using a pen with nano needles, so they're barely getting into your skin, then yes, you absolutely can needle every single day, and it's really a great practice. I suggest that you do it at night, and that gives your skin time overnight to, the pink will go down and you will wake up with glowy skin. It's a great, great practice. It's a great way to infuse your skin with antioxidants and other things that are really good for your skin. So the answer is definitely yes. Now, that is absolutely not to say that if you go any deeper than 0.3, that is the max, then no, you definitely should not be needling every day with anything like that. So that leads me to my second question, which is, I have a list, you guys, I took notes. How often should I needle for collagen / anti-aging? Now, the answer to that is every 4 to 6 weeks. And there's really good science for that, you guys. There is an enzyme that is produced called collagenase, and that enzyme is kind of responsible for remodeling and kind of directing the excess collagen. And as we do things like collagen induction therapy, that enzyme peaks at 2 weeks. So if you needle your face with a 0.5 or anything deeper, and you do it every week or every 2 weeks, you keep that collagenase enzyme peaked at all times. You might think, hey, I'm getting great results. I see great results. But the likelihood is, if you are rolling more often than every 4 weeks with 0.5 millimeters or deeper, that what you're actually seeing is something called edema. You're seeing your skin in a state that is kind of inflamed, so it appears less lined or less wrinkly, that kind of thing. But the truth is, in the long run, you're actually doing yourself a disservice. So any needles that are 0.5 or deeper or longer, however you want to look at it, those should be only every 4 weeks. And just do yourself a favor and nano needle or use a derma roller with very short needles every day. And once a month or once every 6 weeks, hit that 0.5 millimeter needle and you will have great long-term benefit from microneedling. Okay, the third question. My cheeks are scarred, medium to deep. Should I use longer than 0.5? No, you shouldn't. Now, I really think that if you have medium to deep scarring on your face, that you really should consult with a professional. It's one of those things where we can assess your skin. The assessment of your skin is super important. So I caution you to really take scar needling into the hands of a professional. That said, if you want to needle for your scars, consider getting a consultation and just getting some direction from a professional. You have to be very, very careful on some of the areas of your face because you can actually scar yourself, and you don't want to be scarring near scar tissue or over scar tissue, you can definitely exacerbate the problem. The next question, when would you use 2.5 long needles? This was actually a question on my video. You will never, never, never use 2.5 needles, you guys. Seriously, the skin on our face is about 1.5 millimeters thick pretty much everywhere, and then you're beyond. There's just no reason. A professional might use needles that are deeper than that for scar revision, but that is in their professional scope and they have a reason for that. So definitely, I just caution you, do not take needles that are, certainly anything over 1, just don't take them to your skin. It is not necessary, and if you feel like it's necessary, you need a professional. Really, just, this is your one skin, just don't screw it up. Is it normal to feel tight and dry after? Absolutely. I feel tight and dry, honestly, like a couple hours later, I start to feel that. You have to remember that microneedling is creating all these micro channels in your skin, and there are micro injuries. And if you think about, like, if you skinned your elbow and how the skin starts to grow back, and of course you get a scab and all that kind of stuff, we are inducing not only collagen, but we're inducing the wound healing process. So what happens? That skin is regrowing. It's going to tighten up. It's going to retexturize the surface of your skin, which is an added benefit to microneedling. You really can get a really wonderfully retexturized surface from microneedling. I'm on the 3rd day right now, and my skin is absolutely dry, tight, and slightly flaky. You don't always get flaky, but you definitely can. That is also super normal. So what I say to people is just be really, really kind to your skin in the days following a microneedling. Use as much moisture as you feel that you should. Use no harsh scrubs. Definitely want to also, add in some hyaluronic acid, and you can use enzymes if you feel like you want to break down some of those flakes, like day 4, day 5. You can definitely use a very gentle enzyme kind of peel. That is totally fine. The next one is, can a person with rosacea microneedle? And that is such a great question, you guys. And the answer is yes. Again, though, I'm going to advise you to talk to a professional. You should never microneedle on pustule rosacea. Don't ever microneedle that. Now, you can microneedle vascular rosacea, just the pinkness. It really can help. When you think about it, rosacea, some of what's going on is the dermis is thin, so you're able to see those vessels. You see that pink a little bit more. It's closer to the surface, if you will. Well, if you can thicken up that dermis, then it kind of provides more of a kind of a barrier between the vessels and the outer epidermis. So you theoretically could reduce some of that pinkness just by way of thickening that dermis. So rosacea and microneedling are definitely friends. You definitely just want to be extra careful with rosacea. Okay, the next question is, can I use vitamin C after microneedling? And the answer is no. Now, I've had this question asked a lot, and I know a lot of people like to use vitamin C, and it's not that the actual vitamin getting deeper into your skin isn't, that's a great thing, it really is. But the problem is there have been cases where granulomas have occurred after vitamin C is introduced post microneedling. You do not want granulomas. They are permanent, and you just don't want to do that. So I definitely caution you, stay away from vitamin C post microneedling. I mean, by a few days. I definitely would just not introduce it any time when any of those channels might be susceptible to taking it in and a granuloma forming. So no. Sorry. Okay, the next question is, can you do makeup the day after your treatment? So you definitely can do makeup the next day. I always tell my clients that, and I have seen some people on YouTube especially say no makeup for X number of weeks and that kind of stuff. And no, you can definitely use makeup the next day. Would I tell my clients that the preferred makeup, if they can avoid wearing a full face of foundation, some mineral tinted sunscreen would be really ideal. But a lot of people need to go back to work the next day, and your face definitely can still be pink or red or have the remnants of pinpoint bleeding. So yeah, the day of your treatment, no. I tell my clients, just leave your skin alone. Don't touch it. do nothing. So I got a lot of questions about the hyaluronic acid and why before and why after and all that kind of stuff. And honestly, the hyaluronic acid is mostly for slip when you're using a pen. The pen needs something to slip along the skin. And hyaluronic acid is just something that our body produces. It is the perfect thing to needle in. Okay, this question is important. Who should not needle? So if you have an active acne breakout, you definitely should not needle. If you have pustules due to rosacea, you should not needle. If you have active herpes, if you have a cold sore, you should not needle. The next question is, can microneedling be done over Botox or filler? And the answer is yes, it definitely can, but, huge but. If you get Botox, you need to wait 2 weeks before you microneedle. And if you get filler, you want to wait 2 weeks as well. So usually what I try to do is we needle before, and you never do them on the same day. You just don't. So the answer is yes, it just has to be spaced out appropriately. Okay, this is one that I get all the time, you guys. What number of needles are best? And this is referring to pens primarily. And I typically use 9 and 12 needles in my cartridges that are disposable and they are sterile. Now, this is really interesting. You will see cartridges that have 36 needles and 42 needles. And so a lot of people think more is better. And it isn't really that it's better or it's not better. What I want you to think of is if you had a bed of nails and you had 100 nails, you might be able to lay down on that bed of nails and not get punctured. And if you had a bed of nails that had 9 nails spread out, that might hurt a little bit. The same principle applies to microneedling cartridges. So when you have a cartridge that has 9 needles or it has 12 needles, the pressure that it takes for those needles to enter the skin is less. So just know that if you have the option to choose 36 or 42 needles, I would probably steer clear of those only because it takes a lot more pressure for that number of needles to actually enter and release from your skin. So stick with the 9 or the 12 needle cartridges and you will get the best benefit without having to do a bunch of pressure. Okay, so this next question is, when would you go over a 1 millimeter? And guys, I caution you never to go over 1. I really think that if you feel that you need over 1 millimeter because you have scarring or you have stretch marks or something like that, you really should consult a professional. If for some reason in your research you see that you really think you need a 1 millimeter or deeper, go see a professional. Ask them, show them what you are concerned with, and get some guidance. Other than that, if you are strictly doing this for fine lines and wrinkles and tone and texture and all of that good stuff, stick with 0.5. There's just no reason to go any deeper than that unless you have a specific skin concern. And in that case, you probably want to consult a professional. Okay, the next question is really interesting, you guys. Which is better, a roller or a pen? Okay, so here's the deal. A pen is actually more affordable in the long run because you're gonna buy the pen once and then you only have to buy cartridges. Now, I encourage you to absolutely dispose of every single time you use a cartridge, you toss it. You do not ever reuse a cartridge. Now, on the same note, I also highly encourage you to not overuse a roller. I know that it's probably unlikely that any of you are going to take the advice to actually re-buy a roller every month, although that would be the best advice I could give you. However, I know that most of you are not going to do that. So in that case, you want to make sure that you really sanitize that roller effectively. A tip for you is to get a denture tablet, get denture tablets at the store, and actually soak your roller in a cup of the dissolved denture tablet and let that soak for half an hour. That's actually more preferable than alcohol. If it were me and I were using a roller, I would actually pull it from the denture tablet solution after 30 minutes and then I would spray with some alcohol and I would put it away. So that's just a little tip on sanitation if you're not willing to rebuy a roller every single time. The last thing that is a positive for the pens is that you can adjust the length on the pens. So you can do nano or you can do 0.5. You can move it around with the pen. With a roller, of course, you just have the one length that the roller is, and you have to buy multiple rollers to achieve different lengths. Another thing for the roller is that it glides over your skin without the use of hyaluronic acid if you don't want to. So if you're somebody that actually doesn't want to use hyaluronic acid, you can use a roller because by means of actually rolling, it will glide over your skin just with your motion, where a pen really does need that hyaluronic acid or that agent, that product, to have some slip. So those are just some pros and cons. You guys, they are both excellent tools. There's nothing wrong with Dermarolling and there's nothing wrong with using a pen. It's really kind of preference. It's what you're comfortable with. And I definitely think that they both can be very, very effective. Is it worth it to use a 0.2 needle? Like, is that even worth it? Does it really even do anything if it's not actually getting in and, you know, inducing collagen? And the answer is absolutely yes. And here's an interesting statistic for you, especially those of you who love to nano needle all the time. When you use a 0.2 roller, for example, the product that you put on actually penetrates 4 times deeper than if you didn't needle at all. If you use a 0.3 roller or nano pen, your product actually penetrates 8 times deeper than if you just applied it without giving it some channels to enter the skin. So, I mean, when you look at it that way, you definitely can see the benefit of nano needling. I mean, I think it's absolutely fantastic. Hey guys, so those are all the questions for today. There were a bunch more questions, but this video would be so long. So what I'm hoping is that if I did not answer a question that you have, if you will leave it down below. This is the first in a series of microneedling videos. This subject is huge. Let me know in the comments if you are a derma roller or if you are a microneedler and how often you do it. If any of this information resonated with you or was helpful for you, I hope that you guys are having a wonderful week and I will talk to you again very, very soon.